Aiken Veterinary Clinic, we try to see the pets twice a year. What we're doing on this dog today would be a semi-annual 1. And twice a year, semi-annual 1, semi-annual 2. Twice a year we split because the animals are aging faster than we are. It's kind of a folklore, myth, legend, cliche that animals age at 7 times the rate that people do, and it's probably pretty close. So seeing them twice a year helps pick up things for those clients that really want to zone in on any issues that might come up. So anyway, but with the semi-annual 1, we try to split some of the diagnostics we do because we do like to evaluate them other than just a physical exam. With the semi-annual 1, we'll check eye pressures for glaucoma. We'll check a heartworm exam, which is a blood test. We'll check stool for parasites. And it's pretty much a head-to-toe, another cliche, but a head-to-toe exam. When you do a bunch of them, it goes pretty quick. So I try to explain to our clients kind of what I'm doing as I do it. Like checking the knees, checking the hips, make sure everything's mobile. Don't worry, man, your dog's fine. But they're all important to get your hands on all parts of the body. You can find ticks, fleas, things that you wouldn't normally find, cuts, masses, sores, and it just gets that extra set of eyes that client may want, the pet owner may want to make sure everything's good. We also do something that's unique to this clinic is what's called a veterinary orthopedic manipulation, or a VOM. It's just a chiropractic adjustment. We use an activator. An activator is kind of, it delivers a certain amount of pressure over each spinal body. Your spine is just kind of a bony case for your spinal cord. So this, machine, so to speak, or it's really more of a cocking agent where it just cocks and delivers a certain amount of pressure that I can control. So it delivers that pressure over the spinal column, and it's, it kind of turns your spinal column into a tuning fork. It's delivering a certain amount of pressure over that bone, and then you get a reaction. And you can listen, you can hear the reaction sometimes if it has a different sound to it. If it jumps like a reflex, you can pick up things that are wrong. And you can also, you're relaxing the dog or cat, and you're delivering some pain management and some therapy while you're also gaining information on their spinal health. The spinal cord is kind of the main highway to the body, and it's the information highway, kind of like the internet of the body. All the information electrically runs through your spinal cord. So it's important to take that into account. One thing I want to say about these exams as well is that with the pets, the twice a year examinations, the blood work, all the things that you do is a way to communicate with the body. With these animals, they don't speak, they don't have symptomology. A symptom is a spoken ailment, and if they can't speak it, you have to find it, or a good pet owner will tell you what they see. So it makes it important to be a bit of a detective, and I'm paid to be good at detecting things and getting them in here twice a year with a good history for my pet owner and getting your hands on them, necessary testing and things. You can get that accomplished. The very last thing we do with the semi-annual 1 is a rabies vaccination as necessary. It's the law. Aiken County has got plenty of its share of rabies, so it's important if they're outdoor in any way, shape, or form that they should get a rabies vaccination. So that's usually the last thing we do because we need to determine their health, make sure they're healthy enough to get a vaccine before you do it. But that concludes the semi-annual 1.